Okay, hold on. Okay, my name is Cynthia, and I'm from New York. And thank you so much, Dr. Klaper, for the awesome presentation. I really learned a lot of great information. I just would like to know about I had calcium score of 0 and a carotid artery Doppler. I would like to know, is soft plaque revealed on the results, or only, hard plaque only on the results? Because I was told that soft plaque is not shown on the results.
Right. The important question: if you got a calcium score of 0, are you at risk for developing plaque in the artery? Yes, you are. Depends what it says you haven't developed in the past, but the question is what's happening in the arteries now. I mentioned in my presentation just now that I have a video on my website called Beyond Cholesterol, because I have so many vegans with high cholesterol. And the gist of that is, listen, it's an inflammatory process. And as plaque is building up, these 6 inflammatory markers show up in the bloodstream: hsCRP and myeloperoxidase and prostaglandin, et cetera, et cetera. I said, if your cholesterol level is up, have your doctor draw these 6 markers that I have in my video there. And also get an ultrasound scan of your carotid arteries. If the inflammatory markers, all 6 of them, are negative, and your carotid arteries are clear and pristine, you don't have the disease, even though your cholesterol might be 240. Cholesterol is not an evil molecule. Your adrenals make steroids out of it. Your ovaries make estrogens out of it. Your liver makes bile out of it. Your liver is making it for a reason. It's not an evil molecule. And if your cholesterol was 230 on a given test, well, on that morning, your adrenals say, hey, we told your liver, we need more cholesterol for steroid synthesis. Or your estrogens, your ovaries told your liver, we need more cholesterol for estrogen synthesis. And the liver obliged. And when that needle went in your vein, at that moment, your liver needed to keep 220 milligrams of cholesterol in your blood. But that's not the disease of atherosclerosis. That disease is artery abuse. It is the result of how the owner of those arteries was treating those inner linings. It's an active inflammatory process from repetitive injury from the animal-based diet. If you're not doing that, if you are just eating rice and beans and greens and fruits and veggies, get those inflammatory markers if you want. They'll be negative. Get on with your life. You don't have the disease, and it shouldn't be a worry for you in that case. Don't worry about the calcium score. If anything, check those inflammatory markers.
Our next question comes from Judy. Judy, please state where you're from and ask your question.
Hi, my name's Judy. I'm from the Philadelphia, PA area. And my question is about the AGEs. If you are baking like a plant product like tofu or nuts, should we be concerned about baking them at a high heat? Should the temperature be below a certain degrees?
Fascinating question. A couple of things. First of all, as long as, and I know you specifically talked about baking, and that's an important issue. As long as you're making any kind of food, as long as water is involved, if you're steaming broccoli, if you're making a soup, or you're making a stew, or you're just in a double boiler with lots of steam coming out from the bottom there, you're safe. You're not going to create AGEs, and that's really the way to get heat into your food is use water in some shape or form. Now, once you get into dry heat cooking, baking, but certainly broiling and frying, evil things happen to the food at that point. Now, of that, frying is the worst thing to do. Frying oil is the worst thing to do. And broiling under that flame, that's just barbaric. I wouldn't eat anything broiled. That said, if you're baking tofu, especially if you breaded it, and it's just in the oven, will you create AGEs? Probably just a tiny amount. There'll be some, but if once a week you wanted to have some baked tofu, I don't think it poses any threat to your health. Enjoy that, but avoid the deep fried tofu, and anything that's fried should not be consumed by human beings.
Thank you. And so some of the speakers that we have say that you should eat nuts and seeds for health. The healthy fats are good for you. And then you have some people, I know Esselstyn on his strictest in his strictest cases, there's no fat. That's it. That's exactly what he does, I think. What are your thoughts on it? What do you see the research saying?
Sure. Okay. Dr. Esselstyn, bless his heart, developed his theories and program dealing with the worst of the worst cardiac patients. Their arteries, every one of them were all caked up with plaque. They had heart attacks, they had stents, they had angina. If you're in that category, yeah, you do not want to be eating nuts and seeds and oils. That's like throwing gasoline on a fire. You don't want to do that. But if you don't have artery disease, there are some benefits in nuts and seeds. There's all sorts of antioxidants, vitamin E, et cetera, and omega-3 fats in walnuts, et cetera. And so one, it depends. If you are on Dr. Esselstyn's plan, and you really need to be there for your angina, don't be eating nuts. That's true. But if you're not, I say hold all nuts and seeds to a small handful a day, period. A small handful of walnuts, just eat them one at a time, make walnut butter in your mouth after. What Dr. Esselstyn's afraid of is if he says nuts are okay, then he's afraid of someone sitting in front of the TV with a 5-pound bag of roasted cashews, shoving them in by the handful, which is what humans do. And he doesn't want to open that door there. And I've asked him, do you really think in a normal, healthy person, no disease, a couple of walnuts is going to cause any threat? No, of course it won't. But again, the amount is the issue. And so hold all nuts and seeds to a small, modest handful a day and enjoy them. And to the greatest extent possible, eat raw nuts as opposed to roasting. Once you roast it, you oxidize the oils. They taste better. I'm a big fan of roasted cashews, but I've stopped eating them. Definitely hold the nuts to a very modest amount, but I think they have a legitimate place in the diet unless you're an Esselstyn patient.
So Dr. Joel Fuhrman has said that he's seen some of his long-term vegan patients come in with dementia. Have you seen anything like that in your practice? And why do you think he is seeing some of his patients coming in with dementia after eating a vegan diet?
Yes. I have not seen patients on vegan diets with dementia. I'll just leave it at that. And Dr. Fuhrman believes it's because these folks were chronically deprived of sufficient DHA in their diet. And so that's why he advocates, he feels that's the missing link that opens the door to dementia there. There's lots of that theory that needs to be tested. It'd be nice to follow people for from the age 30 to 90 and see what they're eating and checking their DHA levels and see what happens to them. But those studies haven't been done. All the studies where these conclusions are drawn are just correlational studies, observational studies. Are not really solid. But he has a point, and it's got me concerned enough to start taking the DHA again. So it might be a thing, but he believes it's a DHA deficiency.
Right. Our next question is coming from Alice. Please state where you're from and ask your question.
I'm from California, and I'm curious about vitamin D and having a critical lab value and being on 120,000 units of vitamin D per week. Is there any harm to be on that for months and months ongoing because can't get the level up?
120,000 units of vitamin D a week?
It's 50,000 per prescription and 10,000 over the counter every day.
Right. Wow. That has me a bit concerned for a couple of reasons. There's definitely a condition of hypervitaminosis D. You can certainly get toxic from too much vitamin D. And the I think the vitamin D is activated in the kidneys, and people who are in kidney failure can't activate their vitamin D. And as a result, they get what's called renal rickets. And they lose calcium because they can't activate their vitamin D. And these folks, this is who that 50,000 unit dose of vitamin D was made for. This is for patients in renal failure who need a big goose of vitamin D because they can't.
Oh, that's not me.
Exactly. That's the point. And because of that, I get concerned about the doctors who prescribe these huge pharmacologic doses of this stuff. What is that doing long term to your kidney health, to your bones, your whatever? We don't know. But I have concern about, you want to find the least amount that will get you, keep that level up in the 30 or better range. And so I would work on scaling. Every week I would cut, every month I would cut back by another 5,000 units and get that down to a more reasonable amount.
And with that dose, believe it or not, the highest I've gotten is between 13 and 20.
Then that might be all that your body needs or requires. That's a bell-shaped curve, and there are folks out in the tails of the curve there that may need much less, and you might need one of those bodies, might need a lower dose. And for us to be flogging your body more vitamin D, I think we might be going against nature there. I would get it up to 20 and take the money and run. I wouldn't push it past that.
Thank you.
Okay.
Thank you.
Okay, and we have about 2 minutes left. So I just want to ask a real, I just want to make it, if you can make it brief. So Brian Clement talks about fruit being an issue potentially with some of his patients. So he recommends that people don't eat fruit or avoid it. What are your thoughts on people avoiding fruit? Are there any conditions that should cause a person to avoid fruit?
I do not believe so. I think fruits, they're mostly water. They come in with vitamins that nourish the tissues on many levels. There's no, he's concerned sugar feeds cancer, and so don't eat fruit. If you want to avoid cancer, don't be drinking Coca-Colas and bags full of Oreo cookies. I agree, that kind of sugar may well contribute to cancer growth. But how many apples can you eat? I think the concern over fruit is misplaced. The high fruit eating folks do not seem to get more cancers. So prima facie doesn't seem to be a risk problem. So it's a theoretical thing that I think does actually cause negative benefit here. I think it's scared a lot of people off fruits that I think would benefit from it. So I'm not in that camp that fruits cause cancer.
All right, great. And we have about 1 minute left. Is there any thoughts you want to leave us with that 1 minute?
Hope. These are reversible diseases. They get caused by the food stream and the lifestyle that we're flowing through our tissues on a daily basis, and get on the diet we were meant to eat, like the gorillas know all about, and watch the magical healing forces your body will unleash and set into motion. It's so exciting and so inspiring and hopeful that we have this control. You don't have to play helpless victim to your disease nor to your doctor there. So take your health in your own hands. Meal by meal is how you create a healthy body, and hopefully we'll just be friends instead of doctors and patients.
Great. Thank you so much, Doctor. It was so informative. I appreciate it. Please unmute the audience. And I want to thank you again.
Thank you.
Thank you, Dr.